Hi, my name is Dr. Delasy, a medical officer from Landmark Healthcare. So with men's health, we are talking about lifestyle modification, okay, that can help men to live healthy lives. So we're talking about eating well, we're talking about exercising regularly, we're talking about regular screenings to prevent men from developing certain diseases. Generally, it's been found that women live longer than men. If we look at our setting in Ghana, the life expectancy of women is higher than that of men. Women are doing about 64 years, whilst men are at around 62 years of age. So, according to a Harvard study, it was able to get a few reasons why men die earlier than women. The first one they cited was men taking risks. So some men are very adventurous. They go biking or they go skiing outside the country, for example. And according to the science, it's noted that a part of the brain that's responsible for judgment and being accountable for your actions in men develops more slowly than women. So men are able to take certain actions and be reckless without considering the outcome. Another reason was attributed to medical risks. So it's known that men have lower estrogen as compared to women, and estrogen is said to be protective against certain medical conditions like heart-related issues. So men coupled with a lack of a healthy lifestyle, probably developing hypertension and diabetes or high cholesterol, is what predisposes them to heart conditions that kills them off. Another school of thought has to do with dangerous occupations. Men are known to occupy most positions in, let's say, a construction firm or to engage in military combat. So we have more men dying on the battlefield or from construction-related accidents. They also spoke about suicide. I'm sure you'll be wondering, how come suicide? One will think mostly women contemplate suicide because of depression. Yes, that's true, but it's known that women do not really go through suicide. They might attempt, but it's usually not fatal. And there's this thing about men not choosing to address certain emotional issues. You see, you never hear of a man who is depressed looking out for help. Well, nowadays, few men are able to express themselves and open up about how they feel, but generally, men do not like to engage in a conversation. So it's known that the suicidal attempts in men are more fatal, and that's another reason for men dying earlier than women. And the last but not the least, men generally hate seeing doctors. Men would always stay home till things get worse, until they report to the hospital. Three major health issues. We're talking about the cancers, we're talking about heart disease, and then we're talking about psychiatric illness like depression. When we talk about the cancers, two of the most common cancers are the prostate cancer and testicular cancer. We have fair knowledge about prostate cancer, and typically we encourage screening from 40 years and above, especially for people with a family history of prostate cancer. Yeah, so with the screening, when you go to the hospital, the doctor can do something called a digital rectal exam, where he places his finger through the anus and reaches to feel for the prostate, to examine the prostate, to identify any features that may be cancerous. The doctor can also request for a lab test that's called the prostate specific antigen, or PSA in short, to tell whether you have normal values, which would tell us that your prostate is healthy or not. An ultrasound scan can also be done to look at the prostate properly to check for any cancerous features. with testicular cancer, as individuals, probably when you're going to take a shower, you can actually feel for your testes. If you feel any swelling that feels abnormal and you're not certain, or you feel any pain, it's best you see a doctor to assess you to make sure it's nothing to worry about. It seems heart disease is becoming a very common medical condition, and there are three things that can predispose an individual to heart disease: hypertension, diabetes, and high cholesterol. As individuals, exercise. It's recommended that you exercise at least 5 days in a week. The exercise shouldn't be vigorous necessarily. You could just do brisk walking for 30 minutes and you will get results. Another thing too is with the diet. With the diet, we are looking at, for example, people who are obese or heavy, if I should use the term loosely. We're looking at losing weight. Losing weight is going to reduce your risk of developing any of these conditions I mentioned. So there's the need to reduce the amount of carbohydrates you take in daily. There's the need to avoid eating late. There's the need to increase your consumption of vegetables, fruits, and reducing food that has high amounts of cholesterol. People who are interested in alcohol or who smoke cigarettes, I would urge you to try to quit smoking and to reduce the amount of alcohol you consume, or if you can abstain, that would even be better. I think it's time for us to beat that cultural stereotype that a man should not talk about his feelings. Okay, those times are gone. We need to open up, we need to talk to people, because there have been instances where men have taken their lives when simply they could have engaged one or two people in conversation about whatever was bothering them, or even a trained professional like a clinical psychologist. You see, because as part of men's health, we are creating awareness not just for the body, health of the body, but the mind as well. So it's important that we create a stress-free environment, or we create an environment that does not judge men for coming out to talk about how they feel. And then if they have a condition like depression, they would open up, seek right treatments so they get better. A healthy person should see a doctor at least twice in a year. If the person is unable to for financial reasons, once a year is fine, especially if you've done routine testing over the years and you've been cleared by the doctor. And for financial reasons, you think just going once is okay, that's acceptable. It's good to do this because if you do regular screening and it's identified that probably your sugar levels are going up or your blood pressure is going up, you can take steps to prevent yourself from developing any of these conditions. So I would highly recommend that at least twice a year is sufficient. Some of the tests that are very important, the full blood count, where you look at your blood level, or what we call the hemoglobin. It also tells us if there's an issue with your white blood cells that help you to fight disease, or cells called platelets that control how your blood clots. We can also do the fasting blood sugar, or something we call the glycated hemoglobin, that talks about how your body controls sugar. We can also look at the kidney function tests, the liver function tests, to see how the kidneys and liver are functioning. We also look at your cholesterol levels. That too is very important. And for men either 40 years or older, we can look at something called the prostate specific antigen, or PSA, to assess the health of the prostate. There are people who feel uncomfortable walking into health facilities to get routine checks. We are living in a very advanced world now, Now we have home services. You can enjoy home services. You can contact your healthcare provider and an arrangement can be done. But for the most part, you can actually walk into any hospital and request that you would want to have a general checkup and get a doctor assigned to you to take care of your health needs, to answer any questions regarding your health. I would strongly urge that we do that. With the lifestyle modification, we're talking about regular exercise, we're talking about the diet, we're talking about getting some rest, okay? Usually they mention 8 hours of sleep. I know most people can't get that because of work, but as much as possible we should try to get some rest. When we talk about exercise, I'll use my personal experience. I tend to cycle, okay? So I have a bike, I cycle a lot, and it's refreshing. I sometimes do that for like 30 minutes. If I'm not cycling, I'm walking, brisk walking, or I'm running. I check my weight to make sure I'm probably maintaining a particular weight. I check my diet. Sometimes I challenge myself. I decide to go on a fish diet for 3 weeks, a month. I also tend to ensure that I get enough rest from a busy work schedule because everything is sound mind, sound body. So exercise is key. You can do brisk walking if you want to start. You can start with 15 to 20 minutes, about 5 days in a week. If that's too much for you, you can actually start with 3 and build up till you get to about 30 minutes. With a diet, low carb diet is fine. Okay, a diet with reduced salt, reduced cholesterol content. Okay, yeah. We would also like to increase our consumption of fresh fruits, vegetables, and grains. These are a very healthy source of vitamins and micronutrients. We could also reduce alcohol, like I mentioned earlier, or typically abstain. I mean, it's to our benefit. And for people who smoke, the best thing is to quit smoking. What I would encourage all men to do is to take your health into your own hands. Okay, exercise, watch your diet, get enough rest, engage in stress relieving activities. Okay, go hiking, listen to music, go swimming, go out with the boys, enjoy yourself. It's life, it's free, it's fun. Get tested, check your kidneys, liver, cholesterol, blood sugar. Get a doctor you can engage frequently, a doctor who can discuss your health issues with you and then get you the best of treatment. Let's take an opportunity during this month of National Men's Health to create awareness and then to also do all that we can to ensure that we live a healthy life.